Hi, thanks for joining our webinar, Optimizing Chart Chases. Today we're going to be covering how we at Mede Analytics can help you optimize your chart chases within the context of our value-based performance management solution. My name is Jason Peely, and I'm the product manager for our value-based performance management solution at Mede Analytics. I'm happy to introduce to you my colleague, Andrea Sorensen. For the last 25 plus years, Andrea has served roles both on the payer and provider side of the healthcare industry. Most recently, she was the Director of Clinical Analytics at the Iowa Clinic, which has one of the highest quality ranking scores in both the commercial and Medicare and Medicaid market in the Midwest. Here she was responsible for leading a team developing the clinic's physician quality scorecards for ACO and risk-based sharing contracts, cost management, out-of-network utilization, gaps in care, and care management identification of high-risk patients. Prior to Iowa Clinic, she worked for 21 plus years at Wellmark Blue Cross Blue Shield of Iowa and South Dakota, doing a multitude of roles throughout those years, gaining experience from claims processing, customer service, actuarial, HEDIS leader, data management, and then became the Director of Analytics, managing all internal operational analytics for the plan. She now is the Senior Director in Product Management at Mede Analytics, supporting the design of the VBPM products of population health and quality. And now I'm going to hand the presentation over to Andrea.
Thank you, Jason. I'm happy to be here today and thank everyone for taking the time to watch our webinar today. I'm really looking forward to sharing what our quality tools can do for you. Some things that we will cover today in our learning objectives is talking about the new changes in the healthcare environment around quality, how chart chases can become challenging, and how Mede Analytics can assist in those challenges. Also talking about analytics from a reporting perspective of how the information gathered at chart chase time will help update your quality measures. We will also demonstrate through the slides what the screens look like in our tool to help incentivize you to understand what the concepts are. We'll talk about preparing for HEDIS. We will also talk about our quality management tool, and then key takeaways that you can leverage to help prepare yourself for your HEDIS season. This quote comes from Gartner: "Healthcare payers must play a new role as a partner, sitting as a data and relationship aggregator that ties together information from purchasers, regulars, providers, and patients." And this is a very important quote because this is truly what's going on in healthcare today. Each player in the roles have to play a new part. In your journey towards quality care, NCQA, as you're all aware, releases a measures list every year, and technical requirements may change every year. Mede Analytics takes care of those new changes in our application in updating the measures and requirements requested. HEDIS data is collected via surveys, medical charts, and claims, and we'll walk through some examples today of how claims admin data is updated as well as supplemental data. And as you're all aware, hybrid method is very costly. The number of resources that it takes to gather chart chase abstraction data can be very costly. So we want to show you how Mede Analytics chart chase can help you streamline that process. This slide represents the timeline of a regular HEDIS season. As you can see across the top, it's a consistent timeline from August through June with very short time frames to be efficient in your HEDIS season. Many times chart chase is inefficient. A lot of people that I've talked with in the payer environment and provider environment use Excel-based workflows and leverage multiple systems that don't communicate well together. With only 10 to 12 weeks to retrieve charts, any small misstep could lead to costly wasted time and further auditor requirements. Let's talk quickly about how our analytics tool can help. Analytics offers a seamless end-to-end solution that allows you to focus on real-time or near real-time assessment of performance and compliance. This is something that really stands out with our tool, and the fact that when you do chart chase and use supplemental data, once that information is loaded into the system, overnight it will cycle and it will update your quality measures respectively. You can monitor and compare performance of different shared savings groups and different kinds of quality measure performance. The additional thing on the track and measure adds supplemental data in a centralized manner. You don't have to sign into one tool and sign out and sign into another tool to do all of the process from analytics to chart chase. It's all centralized in one application. And lastly, assigning audit tasks to make sure that you're assigning chart chases to appropriate staff. You can move around chart chases if you had an abstractor who wasn't able to complete an abstraction and reassign staff. And all in all, the goal is to boost compliance, leveraging the data that is gathered from chart chase abstraction and loading it into the system overnight so that your quality measures increase based on that information gathered. So enough about the background. Let's jump into how Mede Analytics can assist you with your chart chase process and your quality measures update. This screen print represents Mede Analytics chart chase tool. As you can see, we've selected chart chase, and this picture represents the sample that is either your 411 sample, including or excluding your oversample, to identify the people who were needing to gather more information to become compliant. Thus, chart chase is needed. As you can see on this screen, there's a lot of information, and this is just a slice of the columns available for further detail. We can filter, adding a filter here to get down to certain measures, certain providers, certain patients if need be. So that's where the flexibility comes in. Many times, the general way of assigning chart chases is to use the provider chase logic, which we recommend as well. But this also gives you the flexibility if you want to have one specific chart abstractor focus on the diabetes measures, for example, then you can assign all the diabetes measures to one or two chart chasers. If you prefer to still use the chart chase logic, focusing in on where you're going to get the best hits of accessing information to fulfill those compliance needs, you have that flexibility as well. This view is, I'm going to kind of go through and play different roles. So this particular view is if I'm the HEDIS chart chase manager and I'm getting ready to assign chart chases to either some internal abstractors, or we can also assign based on security roles, set up access for external abstraction companies. In this case, as you can see, again, more columns listing different member information. We've de-identified this for privacy purposes in the sample data, but you'd have your member ID, last name, first name, date of birth, age, and as you go farther along to the right in this table of data, you will see exactly which measures the patient is either non-compliant for, and again, you may have members who are non-compliant for several measures. Once you've identified the filtering from the screen we were just talking about of how you want to set up and assign your chart chases, this screen actually represents, I'm selecting these 4 rows for these 4 different patients for cervical cancer screening. You can select one, many, or all. To choose all, you choose this box, and it would assign or select all of the patients within this page. Once you've identified which patients, you would then click the Create Chart Chase button, and it would take it to this section. So this is where the HEDIS manager assigns the chart chases, and it is literally as easy as 1, 2, 3. The one you identify for this cervical cancer screening, when does this need to be done by? I am the owner in this case as the manager assigning it. And number 3, who am I assigning this to? What this will do then is once I've assigned it and hit submit, it will email the person who was assigned, letting them know, in this case, like this email example, a chart chase has been assigned for them. They can either sign into the chart chase system, or they can easily click a link in that email to go directly into the chart chase application. Now I'm switching my roles. So the last few slides, I was the manager making the assignment. Now I'm going to play the role of the actual abstractor. So I've gone into that email that we were just talking about, and now I see my cervical cancer screening assignment that was set up for me. And I see the members. I would see all the demographic information here, member by member, of who I need to gather information for. So assuming that I walked through and got the information for the provider and I know exactly where I'm going, I as an abstractor am now sitting in the physician's office or I have the medical charts available for me in front of me. Our system is very sophisticated in that it understands based on the measure that I'm working on, and in this case, the cervical cancer screening, I, as the abstractor, need to identify, do I have evidence of compliance? Do I have evidence that this particular patient should be excluded from the sample, or did I not find any evidence at all? Once I've selected one of these in this drop-down arrow, it will open up, it's kind of a tree-based decision-making process. It's smart enough to know that if I chose submit evidence for compliance, such as this example here, under measure status or measure update status, what is the date that showed the compliance, and what are the dates of any other information that's applicable to that particular measure. So in this case, again, we're focusing on cervical cancer screening. If this was a blood pressure measure, for example, and I chose submit evidence of compliance, it then would open up the correct boxes according to that measure to enter the systolic and diastolic values, as well as any dates that are applicable. This next one is actually an example of submit evidence of exclusion. So you can see here it was selected, and then I need to click the drop down, and it's smart enough in the system to know based on our measure of cervical cancer screening, what are the appropriate and only the appropriate exclusions for that particular measure. Once I select either my inclusion criteria or my exclusion criteria, I would move on in the process. Lastly, just to make sure we don't forget it, if I have the medical chart in front of me and I have found no evidence of compliance or no evidence of exclusion, I would select the no evidence found and move forward in the process. Lastly, it's very important once I've identified either the compliance triggers as well as the exclusion requirements, I need to attach the medical documentation that proves that either I found the compliance factor or I have found the exclusion. The next step in our process is to go ahead and add the file, which normally is either scanned in at the time of the review, or if it's a fax process that you're using in your HEDIS process, that fax would contain the medical record documentation, which you would then either scan it in or use your fax scanning process and save to a central repository. Once you click this add file, it's very much like Microsoft in that you add the file, you browse, you find the medical documentation or the page that represented the compliance or the exclusion, and then you save it and upload the supporting evidence. That medical documentation is then attached to that specific chart case, and it can be referenced at any time in the future. This is very important because when I was part of the HEDIS team, when I was at a payer, there were times where the auditor wanted actual copies of that medical documentation when they selected their chart sample that they wanted to validate. This makes it easy that you can search that particular patient in the system, and you can click on the link that will bring up the medical documentation and put it either visually in front of the auditor or print it off easily there as need be to share with the auditor. I've gone through the process of how we assign abstractors. Beyond abstractors, when I am an abstractor and I'm loading the information into our system. And now I'm back to, as the manager of a HEDIS team, I need to ensure that my HEDIS team of abstractors are efficiently getting the chart chases that we need. Because again, that 10 to 12 week time is very stringent and very short amount of time to ensure we get everything that we possibly can from chart chase abstraction loaded into our tool to get the best updates and boost all of those medical record review measures. In this case, this workflow shows that I can search by different chart chases groups. I can search by the measure year or the status, and I can identify where I'm at on everything that I've assigned to my abstractors. So I can see how many are completed, how many are still open, who's assigned to it, and when they need to have it done by. It's also important, being a part of a HEDIS team internally as well as supporting your auditor, that you need the ability to have a very transparent view of the data as that information is being gathered, to be able to identify what was the artifact that either made them compliant or either made them an exclusion. And as you can see in this screen print, some examples of the rows of member information here. Here's different CPT codes that made these patients compliant or non-compliant. This information can then be shared as part of research or shared with your auditor. So some things that you can do to prepare for your HEDIS season is plan ahead and define your resources. I recommend leveraging information from prior years to identify your provider chart chase logic, what worked best, where did you find the most information that was appropriate to making someone compliant or in some cases non-compliant, as well as ensuring that you have the right number of chart abstractors based on your population, which you're doing HEDIS NCQA compliance for. Also, recommend that you reach out to your providers ahead of the HEDIS season to remind them, which they tend not to forget, but to remind them that the HEDIS season is coming and that you will be reaching out to them for medical record information, either via fax, depending on your process, or an abstractor in person to gather that information. Ensure that you train the provider staff on the latest collection requirements, and also train your abstractors to ensure that they know the new year-by-year updated technical requirements of what's required for each measure, and especially spend enough time from an IRR screening perspective to ensure that your auditors, i.e. your abstractors, are understanding those requirements so that they know any new measures that are brand new that they need to get up to speed on, or to ensure that they remember which fields need to be gathered to make the patient compliant. And lastly, from a quality checks perspective, everyone does it differently when it comes to oversampling to ensure that you're doing testing on your auditors, that they're gathering the information. But it's extremely important throughout the HEDIS season to do quality checks to make sure that things are being gathered as need be. So I've given you a little view of our chart chase tool, and now I want to talk a little bit more about quality management. Quality management is our quality tool at Mede Analytics, and it actually does contain chart chase, which is something I'll talk about here in just a moment. But quality isn't just about HEDIS quality measures and gathering information for chart chases. It's also looking into industry and CMS quality measures. We have patient safety hospital indicators. We have star ratings. We have HEDIS, as we've talked about. We also have patient satisfaction and many more that you can see here on the screen. So it's important to let you all know that not just the focus of chart chase, but we have a quality management tool that manages a multitude of quality measures across the industry. And now I want to focus a little bit more on other things that our quality management platform can do. As mentioned, it's not just chart chase abstraction services. Those are listed here below, and that's what we've been talking about at the beginning of this webinar. Other things that our quality management tool can do to help you is HEDIS certification. Again, we are and have been certified for 5 years on our HEDIS quality measures, but we can also help you in that submission to become a HEDIS certified payer or provider. We also do hybrid and capped sample frames, and we do a multitude, as we mentioned, of other quality measurement reporting. This hybrid advanced measure support, these are things that we've been talking about on this webinar regarding the chart chase algorithms, the abstraction tool, how to upload and all your supporting medical information, and how to have all the information available for your auditor. But beyond that, we have additional capabilities for the reporting and the analytics, which take the information from the hybrid samples and the supplemental data that's gathered during chart chase abstraction. And as that information loads back into our system, we can then update your quality measures and report information about those quality measures. So we can identify members who have a gap in care, providers who maybe have multitude of gaps in care where we can implement some recommendations or interventions. We can identify cohort analysis, so we can compare diabetics and all the different diabetic measures and look for opportunities where is it a certain age group that's driving your non-compliance with your diabetics. We have benchmarks, and we also have the ability to create custom measures. Lastly, as we've talked a little bit about, the NCQA reporting features, we are certified with the IDSS submission, and we would actually export, but once the chart chase season is done and you're happy with everything that's been loaded into the system, we will then export the data in the IDSS format, which has been certified by NCQA with us, and that information can then be uploaded into your NCQA portal. All PLD or patient level detail fields are certified and meet all CMS data submission requirements. In summary, our goal is to help you optimize your time with your resources and have the best chart chase logic to meet your needs. We want to help you with all your challenges in your quality reporting to focus on productivity and reduce costs by having faster identification of measure compliance, better assignment of abstraction resources, and a quicker turnaround of information to help support your auditor requests. Mede Analytics can help you spend 60% less time on your quality reporting and submission process, 30% less time in chart chasing because we help you focus on the population and assign resources accordingly, and 95% less temp help or your third-party vendors because we help you focus in on the population with information from prior years that you've gathered to help make every year better and better. Lastly, if you're interested in scheduling a demo to getting down into further details, or you'd like to learn more or have questions, please feel free to use the links on this last page at www.medeanalytics.com/request-demo or info@medeanalytics.com. Thank you for your time today, and we look forward to helping you with your quality solutions in the future.